Hello, my name's Mackenzie. So I decided to do my final presentation on eating disorder. Um, so I know someone that has an eating disorder, and has struggled a lot with it. So an eating disorder is defined as eating a lot or not enough that causes you to gain weight or lose weight. It also ultimately affects your body negatively, such as your health, emotions, and ability to function in everyday life. Um, so Laura has been diagnosed with an eating disorder that has made her life very difficult. So the background about Laura, she's 24 years old. She lives at home with her parents, where she has an emotional support animal, or ESA, to help keep her company during the day. She also has three siblings that are very similar in age. They also go to college. Two of them have graduated, um, such as Laura and her sister. Laura is the oldest. She has also graduated from college, like I said before, and has had a hard time finding jobs since she has graduated due to COVID. So I created a list of questions that I asked her, just to get to know about like what her situation was. So the first question I asked was, "Can you tell me about what was going on in your life when you were diagnosed with an eating disorder?" Um, Her answer was that she was in high school as a senior. She started going to the gym after being recommended by her therapist to get help for an ongoing issue with depression and anxiety. She was unable to eat enough due to chronic nausea because of the anxiety that she had. She also lost weight rapidly due to working out and not eating enough. The second question I asked was, when were you diagnosed with an eating disorder? So she said around February 2015. The third one I asked was, what caused the depression and anxiety? She did not know at the time when she was diagnosed, but she was diagnosed with OCD, which was and is genetic for her. Question 4 was, how were you diagnosed? So she said first she went to a dietitian. Dietitian could no longer see her due to the inability to follow the meal plan that the dietitian was prescribing her, and then also the continued weight loss that she was continuing to do. She finally got a consultant at an eating disorder treatment center. Question 5 says, what tests were used to diagnose? She has had a full day of physical and psychological testing, so blood work, EKGs, examining growth charts, psychological testing and questioning to understand like what's going on with her brain or her mind. Question 6 was, what was the treatment done? So the treatment that she said was done was FBT treatment. She was also hospitalized multiple times. And finally, she did long-term residential treatment. The next question I asked was, what was residential treatment like? She described the treatment as torture that ultimately saved her life. She lived there for several months. The day was spent in groups and individual appointments. So, basically talking with everyone, making sure that you are okay personally, and doing follow-up appointments as well. Question 8 was, how did the eating disorder affect communication? So, her body was actually very deprived of energy, that it was hard to talk. So the eating disorders are very isolating and secretive. It was also difficult for her to express thoughts and feelings. How did residential treatment affect her communication. So she learned how to verbalize how she was feeling. She was also forced to advocate for herself. She also had a more normalized brain functioning, which allowed for more rational communication. And then finally, question 10, how has communication evolved since being diagnosed? So she said that at the beginning she was not verbal about her diagnosis due to mental health and physical issues from the eating disorder. She would also consider herself as an expert at putting feelings into words and talking about difficult things. So the background information that I received was that she has siblings. She has 3 of them actually, and she went to college and graduated with a communications major, which I find very inspiring and interesting. She has also given speeches about eating disorders, as well as having an emotional support animal to give her life and purpose for living. The most interesting thing that I found was that she was recommended to go to the gym, that ultimately contributed to her eating disorder and OCD as well. My learning from this was that mental health can severely impact someone's ability to communicate. The best part of this story to tell was that she ultimately improved overall and is doing a lot better currently. Quotes that capture the message. How does this inform how we talk about the individual? So something that she said was body was too physically depleted to speak without difficulty, and then learn how to communicate verbally what was going on inside my head. So I talk about this individual on a higher level based on the trauma that she has faced. It's very difficult to go through something so difficult and be able to talk about it afterwards. So going through all that and learning how to communicate about that is very good to see in someone who has gone through trauma like that. And then the conclusion. So mental health is very serious, should not be taken lightly whatsoever. Unfortunately for the individual that I interviewed, she suffered from an eating disorder that pushed her to the point where she wanted to die. And the doctor said within 24 hours time that she would die if she did not eat something. And her communication suffered at first, but she ended up majoring in communications and does a better job at communicating about her feelings and what she puts into words. So that is my presentation. I hope you'll like it.